Hello, everyone. My name is Miranda Lay,
And I'm Cheyenne Walker.
and today we're going to be talking about environmental illness and social isolation, a comparative analysis of lifestyles restricted by illness. So here is a roadmap of the topics that we will be talking about today. First, we'll be talking about what environmental illness is and who it tends to affect. And then next, we'll be diving into the methods that we employed while conducting this research. And then we'll draw some comparisons between the life experiences of people with environmental illness and those with COVID-19. And finally, we'll draw implications from these comparisons and talk about what we can do moving forward.
So we use the umbrella term environmental illness and MCS, which stands for multiple chemical sensitivity, to describe various different ailments in which environmental toxins and chemical exposures result in life-altering symptoms and lifelong diseases. The communities it affects most largely include women, transgender, and gender nonconforming individuals, as they are disproportionately exposed to toxicants through strategic marketing of products that specifically target them based on traditional gender roles of personal care products, different cleaning products. And furthermore, this is further complicated by individuals of color and lower socioeconomic status who are also more likely to be exposed to toxicants due to the areas in which they live and the different jobs that are available to them. So the question that we want to talk about today is, what are the correlations between living with environmental illness and living under stay-at-home orders during the coronavirus pandemic? And how can we look at this through a gender framework?
So here we will get into the methods that we employed while researching this topic. Our primary method of research was oral histories. And what an oral history is it's a qualitative research method using interviews to capture a person's life history. And the reason that we and the Center for the Study of Women use oral histories is because they capture more than just numbers. They encapsulate the lived experiences of women with multiple chemical sensitivities. And our ultimate goal with using oral histories is to elevate the stories of women who have been impacted by environmental illness and thereby push for substantial change. And who are we going to be talking about today? So as Cheyenne mentioned in the previous slide, certain communities are disproportionately affected by MCS, such as women, transgender, genderqueer, and non-gender conforming individuals. And then finally, how did we conduct our research? We did interviews, transcribed and coded those interviews, and also gathered some data from the archives of oral histories. And our presentation today consists of select quotes that highlight some important themes regarding life with environmental illness.
So the first thing we want to talk about is financial instability. And as COVID-19 has quite clearly illuminated, individuals of higher financial status tend to fare better when confronted with life-changing illness. So the first quote so clearly encapsulates so much of what our interview subjects go through. And many of the women that we have spoken to have lost their jobs due to products in the office that trigger them. And when they mention these issues to their companies or bosses, they're usually not believed or found to be difficult or hysterical. And only a couple of the women we have spoken to were able to work from home to avoid certain triggers. So we also want to talk a little bit about the housing insecurity that these women have faced. Owning a home is a luxury in and of itself, but many of the women we've interviewed are stuck living in pre-owned apartments without the ability to know if they will be exposed to triggering toxicants from previous owners or renters. Many have had to move due to mold exposure, neighbors' activities using different toxicants or personal care products, or even a relative that they live with, perfumes or different care products. Having the space to separate yourself from individuals who will either trigger an illness or spread one is an exercise of privilege, both for these women who deal with environmental illness and during the COVID-19 pandemic that we're all living through. In the year spent doing this research, so many of our participants have demonstrated that it's a privilege to doctor shop to find someone who believes you and can help you. It's a privilege to afford housing that doesn't make you sick. It's a privilege to be able to change jobs, not work, or leave a toxic workplace. And while so many of our participants have struggled to find the right doctor or place to live, there are countless people with MCS that are left without a safe work environment, health insurance, or are left homeless.
So next, I will be getting into some of the obstacles faced by women with MCS who are trying to seek medical care for their symptoms. So this first quote was extracted from an interview with a woman named Sherry Truitt. And what Truett is explaining is when she sought treatment for these symptoms, her doctor essentially said to her, "I have no idea what to do with this person." And this illustrates the lack of awareness that many medical professionals have around MCS. And often as a result, people with MCS often don't get treatment for their symptoms. Which leads me into my next quote from a woman named Rowena Ilagan. Here, Ilagan explains how extensive the search for help can be when you have MCS. As she says, "I've gone through the loops already. I went to a lot of different doctors before she was able to find the right one." Women like Ilagan have to go through several different doctors to find one that can appropriately treat them. And even then, not many women can afford to do this, as Cheyenne had talked about previously. Now, how does all of this compare to the COVID-19 pandemic? In either situation, marginalized individuals are more likely to contract COVID-19 or MCS-associated symptoms, but then they are also less likely to receive proper medical care. So we can see that public health, public safety, and all of the things related in all circumstances are inextricably tied to societal factors like gender, race, disability, income level, and more.
So it's likely that all of us are sitting in our homes right now, and we've probably only seen a handful of people in the last month or so. I know that I feel like I'm losing my mind, but during this time, I've read and transcribed a lot of interviews with women who have been living this way for a very, very long time. As you can see in the first quote, RH states, "We have to be really intentional about when, where, how we spend our time, and who with, just because of sensitivity issues and illness." These women live every day keeping their distance from others for fear of proximity, triggering a wide spectrum of unpleasant symptoms.
And along with interruptions in their social life, women with MCS often face obstacles in the completion of simple daily tasks. As Carvalho outlines here, she used to be able to go shopping at the mall and grocery shopping and things like that, but now because of her symptoms, she isn't able to do this. So a lot of these daily tasks are things that are common to us, like grocery shopping, going to work, or any activities that involve entering a public space. And I'm sure this sounds familiar to you all, as many of us are facing the same interruptions in our daily routine because of the current pandemic. And this leads us into our discussion of the implications of all of these observations.
So AB talked about MCS in relation to COVID, saying how people like her have essentially been living with COVID for years, but it's also worse now because everyone is cleaning like crazy. She said lifestyles haven't changed, but we're affected worse. There's many parallels between the stay-at-home orders and the restrictions that MCS has on an individual. And while a pandemic will inevitably take priority, what we do with the periphery information it illuminates is so essential. It's only when we're all forced to grapple with the broken structure we live in that we realize what the women have been saying this whole time. MCS is not taken seriously by employers, friends, family, and even healthcare professionals. And just like COVID, it's the most marginalized communities that are harmed the most. And while we don't have the answers to such a complex problem, we do believe that there's so much we can learn from the experience that we're all presently living through. We can use this experience of living in their shoes to advocate for their health and become better allies and citizens. We can change our voting practices to vote for initiatives that better serve public health, and we can change our personal hygiene to be more mindful of the products that we use that may trigger toxicants in other people and in ourselves. As a community, we can pressure people in power to reform societal structures that limit the lives of people with MCS.
So as Cheyenne mentioned, there's a lot of things that we can learn from our project, and as a result, we can take them going into the future. So on a personal level, we ultimately hope that this project informs the public on how fragrance products and chemicals lead to environmental illness and worsen the symptoms of it. And we also hope that this project raises awareness about how chemical exposure is gender specific and diminishes the livelihood of significant groups of women and other marginalized communities. And on a grander scale, we ultimately hope that this project encourages policymakers, medical professionals, scientists, corporations, and other people in power to properly address the burdens of impaired mental health, insufficient social connection, and economic struggle that those living with environmental illness have to shoulder on a daily basis. There's a lot of attention and action being put towards improving living conditions for people under the current pandemic, and all of it is necessary, of course. But something that we can take out of this is recognizing how people in power have the ability to improve people's quality of life if they are compelled to do so.
Thank you so much for your time, and thank you so much to the people listed for all of their help and encouragement.